Hi everyone, welcome back to my channel. In today's video, I will share to you guys about Max's eye surgery. So if you have seen in the previous vlog, when we went to Cambridge Hospital for his follow-up checkup, Max was diagnosed with level 3 ROP, which is the retinopathy of prematurity. That means that there are some problems with the development of the blood vessels in his eyes, and he needs to have his surgery done right away to correct it, or else he will lose his sight. So that's what's happening right now. Because it's very urgent, the eye doctor booked Max for the surgery this Friday. And we talked about what's going to happen to him, how long it's going to take. So we've asked a lot of questions. Especially considering Max's other medical issues. The first thing that was discussed was the schedule. So it was booked for 7 a.m. On Friday. Now the concern with that is we don't have a car, and the travel from the town to Cambridge will take an hour by train. Just considering transportation, it's a bit of an issue for us. So we were thinking of probably staying in a hotel or an accommodation before the surgery. And then the doctor said, of course, because of this operation, Max will have to be put under general anesthesia. And when people have general anesthesia, one of the precaution or one of the orders is to have that person kneel by mouth, or he or she will not take anything by mouth in a few hours before the surgery. So that's a big issue as well for Max, because he has some problems with his adrenal glands, and that means that he has a tendency to have low blood sugar or hypoglycemia. And so my husband had raised this concern with the doctor, and so they are considering admitting Max the night before the surgery in the hospital, which is a very good thing, because the moment that he will be kneel by mouth, he will have a cannula. And the video earlier stopped because my card is full, so I had to erase some files. So I was just explaining there that Max will need to be admitted the night before his surgery so that they can give him IV fluids while he's fasting, which is a relief for us, because we're already in the hospital, then he will be closely monitored before the surgery. And also they said that because he's a baby, after the surgery he will have to stay another night so that he will still be monitored. So he will be monitored for 24 hours post operation. So that is now planned, that we will go there Thursday night. Now the problem there was when we checked for the train tickets, there was no trains at all, because that is when they will have train strike here in the UK. And so That's another problem that we have to solve. We called the taxi companies around town and we asked them how much they would charge us for a private car just to send us from town to the hospital, and they charge about 60 to 80 pounds, and that's just money, you know, but that's really huge. That's a big amount considering it will just take what, an hour and a half or just an hour. So we're a little bit hesitant. So we tried to ask some friends who have cars who can probably, you know, help us. We'll just have to fix our face, and everything that we're doing, of course, is for Max anyway. So we will see what will happen, but that's one of the issues we're fixing right now. And then another one is that the site manager explained to us that usually it's only one parent who will stay with a child in the hospital. But because it's me and Romeo who will go with Max, that means that one of us has to stay in an accommodation. Luckily, the site manager from the hospital told us that she will try her best to find an accommodation for a parent for us, you know, which we're very grateful, because that means, you know, we can, of course, save money. We don't need to book for a hotel, and usually this accommodation is just very close to the hospital, which means it's very convenient. If there's anything urgent, for example, then that person, or probably Romeo, who will stay there, can just go to the hospital and help us, or help me out with Max or something. But we have plan B and plan C, obviously. So for plan B, if there's no free accommodation from the hospital, we have to really book for a hotel or any accommodation that we can get for that night. And plan C is for Romeo, because he has a friend who lives in Cambridge. We can probably ask her if it's okay with her to stay at her house, or I don't know, like a flat, just for the night or 2 nights. So we have, or Romeo has a place to stay. But yes, we will wait for the call. The site manager updated us earlier and said that she will try her best and will give us an answer at the end of the day. So we're waiting for that.
2 hours later.
Managed to find someone who will drive us to the hospital for a small amount. Shout out to Kuya Warren. We rang the hospital that we are still coming, but just a bit late, and they're fine with it. The bed is still reserved for Max. So we arrived at Addenbrooke's hospital probably at 10, around 10. So it's a bit cold outside, so we brought lots of blankets for Max. And so far he's just okay, well behaved. He didn't cry or anything. He just slept all throughout. So we've arrived late, but at least we're still here. So we're heading to Ward D2. Okay. Or Costa. We're gonna buy something to eat first. Probably in Costa. So ikaw na? Ikaw pa din. Ham and cheese. And hot choco. Oh, there's travel. So that is Max's cot for the night. We have 2 more pediatric patients in that room. We are situated in the middle. We're just having our snacks, midnight snacks. So that's Max sleeping. We have his bed the way he likes it. And on that side is where I'm going to sleep for 2 nights, as well as our luggage. So we had to just draw the curtains up to provide us with privacy. I still managed to express milk, of course, every 2 to 3 hours. So this is Max with a cannula, and that's me and Max as Romeo already left for the night. Visitors are only allowed until 8 p.m. and it's only 1 parent per child. So I have to do the feeding, cuddling, and making sure that he will have a good rest, as he will have his surgery for tomorrow. So that's Max with his cannula. He also has IV fluids. It's already 4 a.m. So the nurse has given him his glucose and fluids through the cannula. I've also have some medications, his regular meds to give him, although he's already nil by mouth, but those are important ones. What are you doing? What happened? So this is in the morning. Romeo came back and was a bit emotional. So we're just having our moment, family moment. We prayed and give support to each other. But we know that Max will be fine after the surgery, so. But still, there are just, some worries. And as a parent, we can't really stop worrying for our children. this is Max heading to the theater. He's the first patient for the day, which is a good thing.
1 hour later.
Hello. So this is the accommodation that Edinburgh's hospital provided us with. So we have two single beds in this room. And then toilet is outside, so it's shared. There is a television, and this side, this is for the wardrobe and the drawer, small drawer in there. So we're just waiting for Max's operation surgery to be finished. So
Baby survived anesthesia.
It will survive.
Delikado pa no?
Made it. Oh, dun sa napuli
Hopefully
mo.
okay ra gud imong eyes. So that's we're here at the recovery unit. Max is still a bit dizzy because of the anesthesia. She's sucking very well. Thank you, we already gawasin mo ko lagi. Tanay ko ko. It's a happy baby.
You're hungry na, be? You must be hungry, no?
Very.
You did so well. Thank you.
Sa ko na ba? Sa kanang pag-open.
Yan.
Retractor na siya.
Sorry about the eyes. The beautiful eyes.
Nabili siya ng spa.
Don't push your eyes.
We're the only patient here.
The next morning.
Who's not happy? Here you go. There you go. You're hungry now. You still have your cannula here and one cannula here. So the plan is just to take this off because it keeps on eating. And make sure that this one just for emergency for backup. But finally, we are heading home. We contacted Kuya Warren still to drive us back to the house. And he agreed. So we're excited. We were all cleared by the surgeon and the anesthetist to go home. All his medications are with us. He was just prescribed with eye drops for swelling, but Max is doing fine.
12 hours later.
Hi everybody. So I just want to close my video regarding Max's eye surgery the past 2 days, because if I don't do this, I'm sure that I will not really finish the vlog, and then it will just be gone. But I want to finish this vlog, so I'm taking this closing video for you guys. Just to give you an update, we are now in our flat. We arrived here yesterday, so we were discharged from the hospital around what was in the morning. But the process, of course, is we have to wait for the TTOs, or the take away medications, which usually, you know, takes time because we have to, well, the doctor has to order it. It will be sent to the pharmacist or the chemist here so that they can verify it, and then check it, double check, and then finally they will give it to the patients or the patient's parents. So that was all done. It was a very long journey, so tiring. Personally, I haven't slept for 2 nights because I was, you know, there taking care of Max for those 2 nights that we were in the hospital. So when we came back, so it's still a lot of things to do. Max is doing well. The first day, probably he was very unsettled. He would really cry just touching him. So I think he had a trauma with the nurses holding him, inserting cannula. He was actually inserted, I mean, they tried to insert cannulas 3 times, and I was there and I was holding him. You know, I was just not looking at him because it breaks my heart. But luckily, the 3rd try, the doctor was able to put in the cannula. If he's gonna try the 4th, I'm gonna really complain, like, come on. But anyway, that was done. So I think Max had a trauma. Every time you just slightly touch his foot or our hands, he would really be upset. He would really cry. Not, you know, his usual cry. It's like more of like a, I don't want you to touch me cry. Just leave me alone cry. But today he's been fine. He's drinking his milk, taking his medications. His eyes are not red or puffy anymore, but we've given him some drops to help with the swelling, and he's taking it well as well. So yep, all good so far. So I will give you more update after we get the result, maybe after the follow-up appointment, which will be this week. Thank you so much, guys, and I'll see you next time. Bye bye.